So we'd like to open today's webinar by acknowledging the land that we're gathered on and expressing our gratitude for its critical connection to the health of all. We also acknowledge the enduring presence and resilience of First Nations, Inuit, and Métis people on this land, and recognize their role as caregivers, stewards, and storytellers across Turtle Island. We believe that parks should play a vital role in providing shared spaces for all people and are an important space for reconciliation and decolonization. In the context of today's discussion, it feels especially important to recognize the legacy of displacement that led to the creation of many urban parks. And we see this legacy repeated and reinforced through ongoing practices that displace people experiencing homelessness from parks today, in a context where urban Indigenous people are 8 times more likely to experience homelessness than non-Indigenous people. So I wanted to draw on Jesse Thistle's work on the definition of Indigenous homelessness in Canada. And he points out that Indigenous homelessness is rooted in more than just housing markets and is better understood as a result of historical and ongoing settler colonization and racism. And in his words, this has displaced and dispossessed First Nations, Métis, and Inuit peoples from their traditional governance systems and laws, territories, histories, worldviews, ancestors, and stories. So we hope that this acknowledgement invites us all to reflect on the ongoing colonial injustices in our park systems and to bring that awareness to our conversation today on homelessness. We invite you to introduce yourself in the chat window with your name, organization, and what nation's territory you're visiting us from. And if you don't know which nation's territory you live or work in, we encourage you to visit nativeland.ca or Whose Land, which we've linked in the chat window.
Sorry, I was muted. Thank you, Adri. For those of us who are joining today's webinar for the first time, or this is your first interaction with Park People, just a quick note of introduction. Park People's work focuses on helping people to activate the power of parks and improve quality of life in cities across Canada. Our national network program provides comprehensive support to grassroots community organizations, nonprofits, and municipal staff across the country that are working to animate and enhance their local parks. Early in the COVID-19 pandemic, Park People wrote a blog post that looked to explore 7 questions that guided our work and will continue to guide our work and reflect on the future of parks. This webinar series was created to directly explore those questions. And in this series, you'll learn about the role of parks in addressing urgent and immediate needs arising out of the pandemic, as well as looking towards the future and understanding how we can create a more inclusive and sustainable future. This webinar series is made possible by the very generous support of TD Ready Commitment, as well as the METCALF Foundation. We're very grateful to them for their support, and we would also like to thank our individual donors who support our continued work and efforts. I'm going to turn it over to Adri now to commence our panel discussion.
Yeah, so we're thrilled today to be joined by 2 incredible panelists. We have Matthew Huxley and Nakuset. They both have quite long and impressive bios, so if you haven't read them yet in full, we'll drop a link in the chat. But by way of brief introduction, Matthew is the chair of the Toronto Alliance to End Homelessness Lived Experience Working Group. He brings a wealth of knowledge and insight based on his own experience living on the streets for many years, as well as his current work engaging with friends and peers living in encampments. He believes that people with lived experience need to have a voice in decision-making, and he's played a key role in informing research on how to engage people with lived experience in COVID recovery. Nakuset is the director of the Native Women's Shelter of Montreal and co-founder of Resilience Montreal, which is a day center adjacent to a park called Cabot Square. She is a dedicated advocate working to improve the lives of urban Indigenous communities. Nakuset has also spearheaded the Cabot Square Project, which is an effort to bring services and programming for people experiencing homelessness outdoors into the park. And it's a really unique and exciting project and a leading model across Canada. So we're thrilled to hear more from Matthew and Nakuset today. But before we open up that conversation and bring on our panelists, I just wanted to take a few minutes to provide a bit of background for today's conversation. So first off, I just wanted to briefly introduce myself. As Molly mentioned, my name is Adri and I'm a project coordinator here at Park People. I had the privilege of leading the research for the homelessness section of our Canadian City Parks report, which we released earlier this summer. And the idea for this webinar grew out of that research. So if you're not familiar with the Canadian City Parks report, this is an annual report that we release based on a survey of municipalities from across the country. And this year we had 27 participating cities. So through our survey, city staff share with us key data and statistics related to parks, but they also tell us about challenges that they're experiencing. And this year we heard from many parks departments across the country that responding to homelessness is a top challenge. And it's worth noting that this survey took place prior to COVID, and since then we know that this issue has only grown more complicated and more urgent. So because this was identified as a top challenge, we chose this as a key focus area to dig into in the report. And we did this through reviewing academic research, as well as interviewing experts with a variety of backgrounds, including housing advocates, nonprofit staff, elected officials, and people with lived experience of sheltering in parks. So we recognize that homelessness is a complex challenge rooted in systemic issues like the lack of affordable housing, growing income inequality, systemic racism, and so on. And we know that a lot of the deeper solutions to homelessness sort of fall outside the realm of parks. But we also learned through this research that there's a real opportunity for us to re-examine our role as the parks community. So we found that often common responses that we see in Canadian cities are centered on displacing people experiencing homelessness from parks. So this can look like defensive design, as you see on the slide, the classic example of a park bench that has middle armrests to prevent people from lying down. But it also includes more direct forms of displacement, such as bylaw enforcement and dismantling encampments. But we know that these methods don't address root issues, and research shows that displacing people from parks actually causes harm. And I'm sure Matthew and Nakuset will have more to say about this based on their own experiences. But what we discovered through our research is that displacement from parks can push people into more isolated areas where they're exposed to greater safety risks. And it can also separate people from their support networks and break connections with outreach workers. And during COVID, we've seen an even stronger public health argument for allowing people experiencing homelessness to remain in place. So authorities, including the Centers for Disease Control in both British Columbia and the United States, have recommended that people living outdoors should be allowed to remain in place and provided with access to basic services. So despite all of these expert recommendations, a survey that we conducted back in June of 51 cities across Canada found that only 16% had stopped clearing encampments during COVID. And through our survey of the public that we also conducted back in June, where we heard from over 1,600 Canadians, we found that 41% of respondents would like to see better integration of services for people experiencing homelessness in parks. So our research sort of makes clear that there's a real need to move toward more inclusive and supportive approaches. But I'm sure that leaves many of us wondering what exactly that looks like. And that's exactly what we want to dig into with today's conversation. So the last thing that I wanted to note before we bring on the panelists is just an acknowledgement at the outset of today's conversation that this is a challenging topic. So we will hear and talk about some difficult realities over the next hour, and we're trying to create a space for all of us to learn and engage with this. So we just ask that you're thoughtful and respectful with your participation in the chat window. And we thank you all for showing up today and taking a step outside of your comfort zone. So with that, we will bring on our panelists. So welcome, Matthew and Nakuset, and thank you both so much for being here with us today. I wanted to start by asking you just a bit about your background in terms of your experiences and your work in parks. And Nakuset, I thought maybe we could start off with you. So could you tell us a little bit about Cabot Square and sort of the story of your work in that park over the years? And remember to unmute yourself as well, because we have you muted.
Okay, so you want me to do an introduction of who I am first, or just?
Yeah, if you'd like, and then just tell us a bit about your work in Cabot Square.
Okay, so my name is Nakuset. I'm Cree from Lac La Ronge, Saskatchewan, Treaty 6. I'm part of the 60s Scoop, so I was adopted out to a Jewish family and been here in Montreal since I'm 3 years old. I have been working at the Native Women's Shelter since 1999. I've been the director since 2004. And in terms of Cabot Square, it's a very particular park in Montreal where a lot of Indigenous people hang out, specifically the Inuit. And it's a park that lots of predators end up showing up, and it's associated with crime. So a while ago, and this is like 2 babies ago, I had an opportunity to meet with people, different city planners and different sort of people that work for the city, and community members, and they were discussing revitalizing Cabot Square and changing the look of it. And they were going to eventually close it down, but they wanted some input. And I was the only Indigenous person at the table. And they thought that it would be a really good idea to like take the people out of the park, the Indigenous population, and move them behind the Omer Dessert, which was like a store that was down the street. Put them in basically like the parking lot behind there. So like out of sight, out of mind, right? So I strongly suggested that they do something else. And I ended up working with Vivian Carley. We had a justice committee, and we created a proposal about what we could do at Cabot Square. And we presented it to the city. The city, the idea was, instead of removing everyone from the park, why don't we bring people to come in and help them? So hire Indigenous outreach workers, hire mediators, always give services to the people in the park. And, you know, I specifically wanted Indigenous people, so they saw someone who, you know, had experienced, you know, the same sort of legacy that they had, to have a conversation and to actually help them. So when I presented the project, the first time, they're like, oh, it's too expensive, it's not gonna work, blah, blah, blah. So I was like, fine. And then almost like a year or 2 years later, they called me back and they said, wait a minute, you know what? Nothing has changed in the park. Let's look at your proposal again. But then they wanted us to do a research to see whether or not it was actually going to be applicable or it would work. So for 6 months, we developed a research, and it's on the website. It's called Learning from Cabot Square for the network website. And then they allowed us to have one outreach worker, and from the Native Women's Shelter. So he's Soto, his name is David Crane, so he works at the park. And then another outreach worker from the YMCA. And then later on, we also, it was great that the Indigenous community had someone that they can speak to, but they also wanted to have people come into the park. And they were afraid that non-Indigenous people would be afraid to come into the park. So we decided to do Aboriginal Fridays. So that way we could have activities that were geared towards everyone, but, you know, but were run by Indigenous people. So like the cover of the today's webinar was of Barbara Daibo. That's an activity. She does hoop dancing at Cabot Square, and we have the Inuit, we have about 3 Inuit people that come and do soapstone sculptures, and we have all different kinds of like throat singing and different kinds of activities on a weekly basis, and they're incredibly popular. That was really long. It's Matthew who's next.
That was amazing, and we will definitely have more chances to sort of dig into some of the programming that you've been doing at Cabot Square throughout this conversation, but thank you so much for that. So yeah, Matthew, could you tell us a little bit about your connection to parks through both your past experiences as well as your current work?
Okay, I am a non-status First Nations Anishinaabe from Port Credit. I've been in and out of the system since I was, some of my first I can remember were sleeping in parks from the age of 14 on. And there has been a lot of change in, I guess, people's perception of the quality of life you can have in a park, and other aspects to it. But I've generally found like a lot of the time, the community members, at least from where I come from, the community members are very, a lot of them are open. There is like a bunch of holdouts due to a lot of this aggression and shelter work going on right now. But I generally find a lot of people are very open to the fact. So I also work for the Toronto Alliance to End Homelessness, and that's an public advocacy group for homeless and mental health, and as well as housing. So we kind of take the bar into all situations. But yeah, I'm all over the place. So up until about a year ago, I was sleeping in parks routinely every night. And just like, just like we said before, they can be like very dangerous places to be, and not just due to like public, but I've had plenty of interactions with city workers and by law enforcement and police officers that have not been the nicest interactions with people. So I like to remind people that, you know, we're all humans, and whether it's someone you don't know, but that person you don't know could also just as easily be someone like your mother, father, brothers, sisters. Like, we're all people too, right? And we all have the need for a home. That's one of our greatest things is, and whether it's someone's tent or an actual house, that's still a house, right? So, yeah.
Absolutely. Thank you so much, Matthew. So something that both of you touched on in your intros that I wanted to ask about is just, you both seem to have experiences with displacement, either personal or professional experiences with displacement in parks, whether that's through, you know, defensive design, as I mentioned, or Matthew, as you were mentioning, sort of direct ticketing and enforcement experiences. So I was wondering, and maybe we can start with you, Matthew, if you could talk a little bit about why this is harmful and why we should be moving away from these approaches.
Okay. Well, I find it harmful because your mental health is really in play when you're sleeping outside. You do feel like you're the bottom of the barrel, and that there's not much that can be that, you know, that will benefit you going on. And it really is reinforced when you have the public or police officers or bylaw officers, or even parks people who say, you know, why don't you have a home? You know, you're a healthy young person, you should have a home. And they don't understand that there's a lot of aspects that go into being homeless. And it's not just like a money situation. There's all kinds of things, like let's say you can't get along with landlords and all that other stuff. So like I keep saying, and this is the one thing I always will reiterate is, right, a place to call your own, even if it's not technically your land. Well, let's call it what it is. It's all our land. But anyways, like whether it's in a park or under a bridge or like behind a building, like that piece that you've set up for yourself, that is your space, that is your home. And you know, everyone needs to have at least something like that to call their own, so that they can feel like they are a member of society. There's like sleeping outside is really, really tough on a regular basis. But when we start taking away places people can sleep and limiting those areas, that's brain just starts saying, you know, we're not worth the effort, the time, and the place to have a set spot for us, or because we're being removed from places that should be okay to sleep in or not. Does that make any sense?
Yeah, that makes a lot of sense. Thank you so much for sharing that perspective. So one of the things that I wanted to ask you about, and maybe we can start with you, Nakuset, is I think we've seen across many Canadian cities greater numbers of people sheltering in parks during the pandemic. Can you talk about some of the changes that you're seeing sort of on the ground during COVID and some of the ways that you've had to adapt your work?
Okay, so because I have to backtrack a little bit to answer this question properly, but the Cabot Square project was very successful for many years until one of the main shelters in the area left. Because although Cabot Square could do accompaniment and support. They didn't offer food and they didn't offer other services, but the Open Door, which was like around the corner from Cabot Square, did. However, they needed to leave I'm not exactly sure, I forget why they had to leave. I think they didn't renew their rent or whatever, but anyways, they were out and they moved across town. So because it was such an essential support, and once it left the area, we found that within a 6-month period that about 10, almost I think 8 or 9 of them were Indigenous people died because they didn't have that kind of service. They had nowhere to go to. And specifically for Quebec, it's important to know that, you know, there was the Viens Commission. So there was an inquiry into discrimination against Indigenous people. And it's really bad here in Montreal. So our people can't access services like everyone else. So if you want to go to treatment, you want to go to the hospital, if you want to, there's a lot of racial profiling against the police. And when they used to go to the Open Door, they were able to have support there, but there was no services in place. So when all these deaths started to happen, I really spoke a lot with the city and demanded that we have a service. And what we did was we opened Resilience Montreal. And the reason why Resilience is called that is because we wanted to have a shelter that was really like Zen when you walk in, and absolutely beautiful. And we're calling it Resilience because if you've been on the streets for all these years and you're still alive, that makes you resilient, and we welcome you. So when COVID hit, all the shelters in Montreal closed down and we stayed open. We stayed open so long that we had too many people in the building, and we were like, well, we're going to get shut down now because there's too many people and we can't do any social distancing. So we decided we're going to go across the street to Cabot Square. Everyone, we're going with you. So all the staff went out and we started to do food distribution out there, and we had our table and we were giving out socks, underwear, shoes, coats, scarves, gloves, everything that they would need to survive. And the city was sort of like, what are you doing? And I'm like, well, we're going outside. There's no, we can't help people if we close down. So we're going to just set up outside. And then 2 days later, the mayor of Montreal decided everyone's going to go outside. So she built 5 other parks in the city at Emily Gamelin, Place du Canada, at the Mountain, another one. And that was considered the best practice. But it's not a best practice because we shouldn't be outside. And we were literally outside for 5 months, every single day, serving 500 meals, freezing outside with everyone else, doing the best that we can to try to help and support them. But that wasn't necessarily the solution. So as of Monday, we moved back into the building, but we can only support 60 people. And that's both staff and, you know, residents. So, you know, we had to cut staff and focus on the people coming in and do it COVID safe. And, you know, I'm very concerned about the second wave because we can't allow as many people in as before. And what happens to those that can't access the services? Back to you, Matthew.
Yeah, thank you so much for that, Nakuset. And actually, before we switch it over to Matthew, I just wanted to ask one question about your work outdoors in Cabot Square. You mentioned that it's not a best practice, and I can imagine there are a lot of challenges that come with doing this work outdoors, but were there any advantages that you did find in terms of transitioning things outdoors into the park?
My goodness. You know, what was difficult was that we didn't, the city didn't consult with us on the design, right? So when I said we're moving outdoors, and they decided that they approved us to be outdoors, I was like, okay, so this is what you gotta do. You gotta get a big giant tent, right? That's heated like the army has, right? And then you gotta get those lawn chairs and then blankets, like what they did, you know, during TB, when everyone was outdoors. And that's how we're going to keep people safe, and we'll distribute food and all that. And they're like, no, we're not going to do that. They give us little tents. And it was not really great. because you couldn't put more than 4 people under a tent. So, you know, in order to, and also in Montreal, they were giving out tickets to the homeless for not social distancing, but if they only give you a small tent, you know, more people are going to gather when it's, you know, raining or snowing outside. So I think the benefits were that we served a lot of people. Everyone came down because we had the best food, and we were giving out sleeping bags, tents, clothing, boots, everything that they could potentially need. We were giving out all day long. That we actually had intervention workers. So lots of people came, but it was a drop in the bucket to actually addressing their needs. Yeah.
Right. So it sounds like a lot of the challenges came from maybe a lack of resources to do things the way that you knew that they would best be done. Thank you for sharing that. And Matthew, so I want to turn to you and ask you a similar question of just what have you noticed has changed sort of on the ground in parks during COVID with the people that you've been working with and some of your friends?
Okay. Well, one of the main things I've noticed is there has been a lot more of a relaxed sort of behavior around people congregating in parks and setting up tents and things like this. At least here in the downtown core. I mean, it's hard to walk past a park right now without seeing sort of some kind of encampment, whether it's just one person or groups of people. And even in the parks that have been utterly gentrified, there are still some of those little parks that are completely like beautiful, and you can tell people are like creating a stink over people being there. Like we had, actually, I was just visiting a friend a couple days ago, and we had 30 people from the neighboring condos come down and actually start like kicking over people's stuff outside their tents just to try and get them aggravated enough to move. And that's not really a proper way to go around doing things, right? Like we need to have open conversations with people. And like most of my friends, a lot of them say that if it's not an aggressive, like an open arms sort of like friendly welcome sort of being in the neighborhood and sort of asking if they're okay and things like that, it's the complete opposite, where it's people getting just completely angry about the fact that someone's taking up space in one of their parks. And I'm not exactly sure like where this whole mindset comes from, where we shouldn't all be allowed to access our public parks. But I mean, that's part of what the nature is. It's a public park, right? It should be for anybody that wants to use it, whether it's for sleeping or hanging out. But like the general like removing people from parks and things like this has really like cut down. In fact, towards the beginning of the pandemic, I noticed it a lot. There was a big uproar about people starting up encampments again and things like this. And now it's sort of toned down because I guess people have been frightened away from like parks that they would normally go to. And they are now like hanging out in places like under the Gardener here, or even that's been dismantled recently, or just places along the lakeshore that's not even zoned for housing and might be contaminated. Like we are now, that's where we have forced people to go and be living. So yeah, it's just hard for me to like see that that's where we're at right now, you know. But I'm glad these conversations are taking place, and it seems that we have a lot of people interested in finding out better solutions to go about including and just interacting with people who are going through a really, clearly homelessness is a really rough period in people's lives. So
yeah,
it's kind of rough. It's nice to have people that are starting to at least be more open and friendly towards homelessness, I guess.
Yeah, thank you for sharing, and just really appreciate you sharing these experiences, because I know you're probably seeing a lot of really difficult things happening with your friends right now, and it's hard to speak about, but it's really enlightening for those of us who don't have as much experience working on the ground. So one thing that you sort of were getting at, Matthew, is tensions that can arise between people living in parks and some of the surrounding housed community. And I think a lot of those tensions sort of center on safety concerns. So sometimes people living in the community who are housed will perceive parks as unsafe when there are homeless people living in them. I was wondering, I think that we don't hear as much about the safety concerns of people experiencing homelessness. And I was wondering, Matthew, if you have any thoughts on what it would look like to make parks more safe for people experiencing homelessness.
Well, I kind of touched on that a little bit, but I'll continue. It's sort of weird because we are all about, I guess cities are all about gentrifying their parks and making them beautiful. And people, I guess the general populace's eyes, that people sleeping in their parks would make it ugly, and like sort of like, why would people be paying for a park that, you know, someone's going to be sleeping in? But like parks are good and bad in many different ways. I mean, they're open, and I enjoyed sleeping in them because they were peaceful, no traffic signs, things like this. But then you've got other places that are fine. Like one of my main parks I used to sleep in was the Grange Park down at John and Queen Street, right around there. And they have gone as far as to put sprinklers in any area that people may sit and congregate, and they turn them on all night long. So no one's got places to sleep. So if you do end up falling asleep there, you're going to be soaked in like a matter of an hour. And I enjoyed like the people. Like, we had a great group of people that used to show up every morning and do their Tai Chis in the park, or their Tai Chi in the park. And half the time we wouldn't be awake yet, and they would show up with coffees for us and things like this. So there's a lot of good and a lot of bad. But like most of the time, if you're clean and quiet and out of the way, you're generally left alone. But that shouldn't necessarily be the case, because some people can't necessarily stay clean or have a hard time because they have disabilities and things like that. Sorry, I kind of lost my train of thought there for a second.
Not at all.
Yeah. There are a lot of like issues. So like, I don't know. I've gotten many a charge from bylaw officers, and even criminal charges from the police for occupying a public space, I believe they called it. And one of their favorite charges to throw at people sleeping in parks is prohibited activity in a public area, which kind of, I can understand their name for it, but it kind of gives it a blanket charge that doesn't always paint the right picture to what someone was going through when they were sleeping in a park, right? So it, like, prohibiting a public activity or a public area could be as simple as, you know, misusing a bathroom or something like that. It sounds really horrible when you're throwing charges out like that. But yeah.
Yeah, absolutely. And I think that a lot of the things that you're speaking about, it feels to me like if city staff or police or some of the people that you're describing who are sort of behaving in these ways, if they could hear you to talk about these issues, they might sort of behave or respond differently. So that brings me to another topic that I was hoping to ask you both about, which is sort of, and maybe Nakuset, you could answer first, but what advice would you give to cities who are looking to start engaging with people with lived experience of homelessness, as well as organizations like yours, on how to improve sort of support and include people with lived experience of homelessness in parks? Sorry, that was a very wordy way of asking my question, but just strategies for engaging with people on this issue.
Well, they should do it. That's a problem. They don't actually do it, right? I think that if they were to go to, you know, either the shelters or, you know, to the areas where people congregate, like in Montreal, there's, you know, Cabot Square. There's also a lot of homeless people that hang out, like at Park Avenue. There's groups everywhere, right? And to actually have a conversation with them, that would be incredibly helpful. And to talk to the organizations that work with these populations. You know, I mean, specifically, I work with the Native population, but, you know, there's other demographics that they should reach out to and really have a conversation and then actually use the information. Because I've been consulted so many times and it's like it goes in one ear and then out the other. It's almost like checklist. Yeah, I spoke to her, I got the news, and not necessarily apply it. But we have a lot of solutions, and if we can't get the city or to implement it, then we do it ourselves. Like at Resilience Montreal this summer, we built an outdoor shower because people can't take showers. Because a lot of the shelters are closed or they have limited capacity. You know, it's a basic need to eat and to take a shower and to rest. So we could provide some of that, but we literally built a shower and we bring people in and we give them towels and soap and clean clothes. And, you know, it's just, it's the bare minimum, but we're offering that. And it's something that we spoke to the city about. And for whatever reason, they couldn't do it, but we did it. So I think that it's really important to, like, you know, meet people and, you know, take notes and then at least apply 50% of it, because otherwise it's just kind of like pillow talk.
And if I were to consult you right now on some of the things on your wish list, what are some, if resourcing weren't an issue, what's your vision for Cabot Square right now in terms of changes you could implement?
I mean, the thing is that it's COVID, right? So, I mean, if you had asked me this question a year ago, I would give you a completely different answer. But because it's COVID, I'm really worried about what is going to be happening once the cold weather comes in and the lack of resources. So I know everyone was like thrilled with Toronto because they opened like a hotel for 500, right? And homeless people. And, you know, I don't think that's going to happen in Montreal because now all the hotels are reopening. But I love the idea of having those, you know, those giant tents from either from like the army that can, you know, be heated, and to have a place where they can rest, and that you can, you know, make it large enough that there's social distancing in between people, because this homelessness issue is going to get bigger now, right? Because of COVID, there's so many jobs that are lost, and we're going to see a trend where it's going to grow. So I want the city to be proactive, and if they were to go back into the parks and put these giant tents up, and, you know, you also need specialized workers to go in, right? Those that can, you know, that understand trauma, that can have a conversation with someone and not ask ridiculous questions, right? To have an understanding, and also to, you know, bring in the different specialists to come in, you know, on addictions, on mental health, on housing, to come in almost like every day of the week to address the issues, so you can help them if they want, from going from A to B, whatever that looks like, you know. And obviously we need more social housing, supportive social housing. So that's it for now. But if you ask me again, I'm sure I'll have another list.
Thank you so much for that. So it sounds like even with COVID, the focus for you is still sort of just improving the services and amenities available in parks. So we're going to turn it over to the Q&A shortly, but before we do, Matthew, I wanted to ask you, for folks who just don't have a lot of background in this area and are looking to take some first steps towards engaging people with lived experience, can you recommend any sort of first steps for them to take, and any barriers or supports that they should address when doing so?
Okay, well, the first thing is to remember when you're talking to people with lived experience is that we have all kinds of levels of trauma, from childhood systemic stuff to stuff that has been that has happened to us outside, and then even in between. So just talking to people like they're human beings and like they're on the same level as you, instead of looking down on people or treating them like they're maybe less like not as smart as you, you know, those types of comments and things like that, they go a long way. Like, we have a lot of people who like, well, that's what I did when I went out and searched for our steering committee and not our steering committee, our lived experience caucus, which then takes notes and recommendations to our steering committee. I did a lot of outreach work to the different organizations that involve the homeless people, as well as actually going out and involving the homeless people. And the best thing that happened was just trying to interact with them as human beings, because they are open. If you don't talk to people like they're equal to you, or take into account that, you know, no one knows what people outside are going through better than people who've actually lived that life, we just have to remember it's a hard thing to even imagine going through. So the best way to like make changes and to come around this issue is to involve people with lived experience. And your best way of doing that is just to get out in the community and start talking to people and doing it with respect. That's the best way.
That sounds like a very, very simple instructions that hopefully folks in the audience will be able to.
I try to make that as simple as possible, right? Like when I'm outside, no one likes being talked down to, right? So.
Yeah, no, absolutely. Okay, well, I'm going to turn it over now to our audience Q&A. I just wanted to say thank you both so much for this conversation. I think I speak for all of us at Park People when I say that this is a really special discussion for us to be hosting. And we just feel really honored and so grateful to have the opportunity to learn from you today. And I'll turn it over to Molly now to lead the public Q&A.
Thanks, Adri, and thanks Nakuset and Matthew for answering those questions so thoughtfully. So we will be switching it over to the Q&A portion of the session. I see we've already have a few questions in there, but if you hover your mouse over the bottom of your screen, you should see a Q&A button, and you can directly access the chat box there. And so we're opening the floor to you. We'd love to have you interact and ask any questions to our panelists. Anything that's come up in the conversation here or just in more general terms. We have Matthew, Nakuset, and Adri all at hand. So if you have a general question, feel free to post it as is. If you'd like it specifically to be directed at one of our panelists or Adri, just mention that in the question. So there was a question that came up here that we'll start with, I think. So have you had any interaction or experience with cities or groups or organizations that do engagement really well, or that you can specifically point to an experience that you've had in the past? And I'll open that to any of the panelists to answer that one.
Okay, I'll go, I guess. So in Toronto, there are a lot of organizations that are set out to help homelessness and housing issues. I mean, I've had a lot of good interactions with them, where you start working with a worker and in about a day, you've got like 15, 20 housing options. But as I've heard from a lot of people, just like normal, a lot of the time it's housing that we don't want to be put into. So dangerous housing, non-dangerous housing, like normal housing, or it's either just really, really, really far away from any services that are possible. So if most of the services are downtown Toronto, we have a lot of housing out here in Scarborough, where it's a lot more distance. It's a lot more of a distance to travel to get to the services and things like that. But most of the, like, I find, and a lot of my friends find, because I just had this conversation with them last night, that some of the city outreach programs need to have some revamping done and possibly restaffing, because we have noticed that some of the staff don't seem to be as enthusiastic about this issue when it's such a massive issue that we are undertaking, that, you know, anybody who's at least trying to work in the industry should have general enthusiasm towards what they're doing. Like, I don't want to show up and see a worker who's gonna hoe and hum and not really do anything, and then I don't hear from them for 3 weeks while I've been trying to get in touch with them. And that's a massive issue with some of our groups here. But other groups are, like I said, right on the ball. You can have housing in a matter of weeks, right? Or days even. So
that's great.
Yeah. I don't want to name names though. That's one of my things. I'm not going to name any of the organizational names.
That's very
for good or bad, right?
yeah, absolutely. Thanks for sharing that, Matthew. Nakuset, did you have anything to add there?
Sorry, ask the question again.
If you have any examples of cities or organizations, and you don't have to name them specifically, or experiences that you've had where you've been engaged in a thoughtful way, or just even solutions in general for thinking about shelter, safe housing and that kind of thing, and how that, if you've had a positive experience, what that looked like.
Not really. The thing is that we have to create our own solutions, and that happens all the time. So I'm working at the Native Women's Shelter for 20 years. 10 years ago, we decided to create a second stage housing for Indigenous women and their children. And we're only going to start building it, I think, now in November. It takes a long time, and we're building it in the model where, women are going to be empowered. And we're going to have the Dr. Julian Foundation involved to help, because there's an overrepresentation of, Indigenous kids in care. And we're going to support everyone so that they can live there up to 3 years. It's going to be an Indigenous-led model. It's taking a long time to create that, and we will be the only ones in Montreal doing that. The organization that we worked with, we needed to do it on our terms. So what Matthew had said before was they had offered a place that was like in the middle of nowhere. And I'm like, that's not going to help anyone if we build out there. They need to be somewhere in the city. So it took that long for it to be created. So I think that, those that know exactly what works should be the ones that lead the project. And what we would ask is all the city officials and organizations that have the capacity to make it happen, listen to us, and then we build. And that's what we're doing here. So,
right.
Sorry if it's not a happy answer.
No. But I think that brings a valuable point around, making sure that the people who understand the problem or, the situation at hand are the ones leading, and those with the resources are supporting and encouraging that. And so this kind of leads into another question that we've got here, which maybe I'll tie into two questions. So one Nakuset ties a little bit into your point there. So is it more important for these communities to be near the services that they need, or to have security and privacy, or do they need to be, distinct from one another? And what exactly, or how would you define or describe a safe shelter or a safe sheltering site?
That was a lot of questions. Can we start with one? What was the first one?
Yeah, sure thing. So is it more important for the homeless communities to be near the services that they need, or to have access to security and privacy?
Okay, but they don't know what the services necessarily are. So in Montreal, if they want to go to an addiction center, there's Onondaga that's in Gunsatage, and they only have, X amount of beds, and there's a waiting list. The other, Toronto has other services that they could use that are culturally appropriate, but that's really far away. So you have to almost build the support organizations within Montreal and then decide when you're going to build. So there's not enough services that people are comfortable going to. And that's why with the Viens Commission, it completely outlines, all the different services where they're turned away or ignored. So feel free to read that report at some point. So, and then it all depends on the person's need. Do they feel like that they need safety? Are they running from an abusive relationship and they need that safe measure? With the second stage housing that we're envisioning, it will be safe, but it won't be like a crisis center. There'll be responsible people that live in, a beautiful 23 unit, housing complex with supportive services. It won't be like we need staff 24/7 like we do at the Native Women's Shelter. So it depends. You can't it's not like cookie cutter for, homeless people. Everyone is different. Everyone has different strengths and different weaknesses, and it's really focusing on what they need to move forward, which is why, like, when we open our second stage housing, we're going to have an addictions worker there 1 day a week, and a psychologist 1 day a week, and our family care worker in collaboration with the Dr. Julian Foundation, and our elder will come in 1 day a week, and our art therapist will come in. So people can utilize the services that are there if they feel they need them. If they don't need them, it's fine. They can just do whatever they want. But if they're literally in the building, they don't have to go too far. Does it sound like I'm yelling? Sorry.
No, it sounds like you're very passionate. Yeah. Yeah, no, I think that you bring up some really valid points there. Matthew, did you want to add anything to that?
Just that I completely agree with, everyone's experience with homelessness is different. Like I have friends who are up in Vaughan who don't necessarily use any of the systems that are in place. Yeah. And they're way outside the city and they're in a ravine somewhere. So they've got their own little community and there's a bit of security there because they have a big group of them, right? But there's also like those core groups of people who are trying to shelter downtown right next to the shelters or the services that are provided for them. And that's where they're being removed from. So we have seen a lot of people like shifted outside of their comfort zone and like, so people have certain services that they have to use and other people don't use them at all. So it's very individual. That's the main way to put it, is each person's experience is individual and their needs are all individual too, right? Yeah. Some people need the support, some people don't need support, some people need community, other people don't need the community. So
yeah, so a blanket approach doesn't necessarily work. It has to be a little bit individualized, I guess. So we'll do one last question, which actually came in from Adri here, which I think ties into some of the questions in the Q&A as well. So if you were to think about how we can better engage both housed and unhoused people together in park events or programming, what would that look like to you?
Well, I kind of have been repeating through most of my things. It's just get the people in your community, which are the homeless people as well. So it's not just your housed people, it's homeless people, it's people couch surfing, because that's a form of homelessness as well. Just input, because they will be able to tell you like what is needed, what isn't needed, and how. I'm sure if you are holding an event in a park or something, if you ask nicely, like as long as the approaches are nice and humanistic, I guess is a word, that's not even a word, but humane, there we go. It's all about your interaction with people. So don't come across hostile, don't come across anything like that. And from most of the people that I know that have been doing community work and sit on different boards and things like that, that is their main concern is they feel like either they're not being listened to, like they're just window dressing, sort of like, oh, we are engaging like the communities and the homeless and the housed people. And then when it comes down to decision making times, it's not being done. So try to remember that the people you're trying to help, their input is the most necessary thing you can possibly ask for. I guess.
Absolutely. Thank you. So we have about 2 minutes left here. Nakuset, is there anything that you'd like to add really quickly to that?
Okay, so if you're gonna have like a big gathering with homeless and non-homeless people, bring food, bring music, bring Kevin Deere. Kevin Deere is an elder from Ganawage, and he always does openings, and he's just the most amazing speaker. And he first starts off just in Mohawk, and then he translates into English, but he is such a descriptive speaker that it's almost like you can understand him. But people need to understand like where they are, that in Montreal they're on Mohawk territory, and have an understanding about everyone who's here and their place here. So if you came from abroad and you live here and you're living in a fancy condo, and if you're Inuk and you suffered from residential school and the dog slaughter, and you come to Montreal and you can't get services, you need to understand people from where they are and then have an open discussion. If you're not open, you're not invited. Sorry.
Yeah. Thank you. Thank you. Okay, so we're going to wrap up here for the day, but before we sign off, I just wanted to direct you that there is a resource website that you can take a look at where this webinar and more information will be housed. We do also have a newsletter, so please keep in touch, sign up. There's a link going in the chat right now. And our next webinar in this series is going to be September 30th, and we're looking at the future of public engagement. So we encourage you to sign up for that. We want to thank everyone again for taking the time to join us today. There is a feedback survey that's going to be dropped in the chat right now. So please let us know what you thought, how you did, or how we did, and we'll be sure to share the resources via email by next week. Thank you again for being a part of such an important conversation. We hope the thoughts and ideas and concerns that we talked about today will encourage and inspire you to take these into your own work. And thank you so much again to Matthew and Nakuset. We appreciate it. Thank you.